think because we met at Michigan when we were students. I was an undergrad and Steve was in law school when we met. But we've always felt a connection. When we retired out here to the Bay Area and had more time in our lives, we became more involved in Michigan activities with the local alumni club and other events that were connected to the university. And we kept trying to go back to Ann Arbor every year or so. Of course, football was always a draw, as well as the Ann Arbor Art Fair. Also, we've continued to be involved with LS&A and the law school, as well as Michigan Medical through the Urology department and the fellows program there. And then our interest in art has led us to become involved in UMA, the Art Museum, as well as the University Musical Society. So there are a lot of temptations at Michigan for us to be involved in.
I was diagnosed with prostate cancer in 2008, and I started reading all these publications. There was one called The Hot Sheet. There were a lot of others. There were probably 4 or 5 different publications that came out every month or two, but every single one of them had a column by this guy named Dr. Mark Moyad. Not only was he writing about prostate cancer, but he was a big fan of Michigan sports, especially football. I managed to find Mark's email address, and I wrote him and said that I would love to meet him. He invited me over to his house, and we hit it off and became friends. From that point on, he's provided ongoing advice not only to me, but to other family members. My brother was diagnosed with prostate cancer. We don't get our medical treatment in Michigan now because we live too far away, but we do get it at UCSF. And so many of our UCSF doctors have Michigan connections. They did their residency, their alumni. I mean, I've been into doctors' offices where they're wearing a Michigan cap when I walk in. The Michigan enthusiasm and spirit and the breadth of the Michigan connection is always astounding. And what I always say to newly diagnosed patients, they're usually going through a very hard time because of trying to make a decision about what to do and cope with the fact that you're newly diagnosed with cancer can be difficult. And I usually say, there's good news and bad news. The good news for prostate cancer, there are multiple treatments. And the bad news is there are multiple treatments, and you're going to have to make a decision and take your time. There's generally no rush, but ultimately among those treatments, you need to think about which one you're going to go for. So I advise them to learn all they can, join a support group, seek peer support, ask lots of questions, read as much as you can, make sure it's from legitimate sources. But I like to get lots of opinions. Some people think it creates too much confusion and ambiguity, but to me it leads to better informed decisions and better thought out decisions. And look for a teaching hospital and look for doctors who have tremendous experience, because everything I've read, and you probably have seen the same, there's plenty of studies that show that a doctor's experience, whether it's radiology or surgery or something else, makes a significant difference in the outcome of the treatment. One of the hard things is in a diverse place like Michigan, if you want to endow or sponsor things, how do you decide between medical research and an English professorship or an art museum and patient care? There's so many worthy causes, and I'm only naming a couple, but it's always very difficult for us to wrestle with how do we want to make our contribution to Michigan. I mean, I have a personal connection for the reasons we talked about to urology in general and to Michigan urology. Something I've said to doctor friends, I don't have the aptitude to go into medicine, never did. Can't stand the sight of blood, and don't have any scientific aptitude, which is why I chose law school. I wish that were different because I admire the fact that doctors can so change people's lives. I mean, I know there's dealing with insurance companies and filling out paperwork, and it's not all as glamorous as it may seem, but also you do save people's lives and improve their lives. You know, what's amazing is there was an article, I think, about our contributions in Michigan Medicine magazine, and I got several emails from UCSF doctors who were Michigan alumni saying thank you for your contributions to Michigan.
We're really sorry that we can't be there in person. Our trips to Ann Arbor are too few and far between, but we're there in spirit, and we're really proud to be affiliated with the university and interested in following the research advances that are going on at Michigan.
I feel presumptuous since we may be talking here to a group full of medical professionals, but thank you all for what you do for your patients.
What's your favorite color, Steve?
Oh.
Blue.
Okay, Faith?
It's blue.
All right, go blue.